GoldenEye microneedling technology is basically suitable for all skin types. Doesn't matter about age, skin condition, or skin age. Because basically, what we do with the needling technology is to boost the natural repair mechanism. And that is perfect and brilliant for all healthy skin. You have to be keen, of course, if there is some areas that shall not be touched with a needle. So a basic dermatological knowledge is absolutely mandatory. You should be able to recognize and to evaluate all skin abnormalities. And if you're not sure, you have a second opinion from a dermatologist, and then you can touch it. Basically, a healthy skin without any problems is possible to touch. And with that, you will make all sorts of your clients happy and more beautiful. Right after the treatment, let's say, well, one says so, one says so. They shall not be underestimating. I would say you should count or you should expect a certain kind of redness. And on some clients, the redness could last a few hours throughout the entire day. And on some quite sensitive clients, especially when we perform the invasive technology or the invasive technique, in that moment you could expect even the next days on some areas, especially the areas where you can find a bone underneath, so the frontal bone or the cheekbones, jawline. So that could be an area when that is treated intensively, the redness could last a little longer. But most clients would think, I'm having a needling technique, and that is basically, we're working in the same area where a tattoo takes place. And after having a tattoo, the skin looks scabby and there is a dry scab healing on top. So do not expect that. So there's not going to be a scab or something like that. The skin looks normal, but very, very, very well activated, put it this way. If in the invasive technique we achieved a certain minimalism of bleeding, then it could be that there is a little dry scab right after the mask, which we remove inside the salon immediately with the disinfectant. There will be, let's say, after 3 days, mostly after 4 days, there will be a certain flaking, especially on the forehead, cheekbones again, so the people can see what happened after we have activated the skin in such an abnormal way, because we really boost the building of new skin cells that are still vivid and alive. So they push the dead cells off the skin, and that you really see. I mean, it's really like snowflakes falling from the skin. In that moment, I definitely would recommend my client, and this is why we also from GoldenEye would always dedicate a lot of time to inform the client for the important after treatment, because the skin is very receptible for all sorts of moisture, all sorts of hydration, all sorts of cosmetics. So our clients will need in the first 3 days a lot of moisturizer, and this, you have to be very keen about that. Your clients are not allowed to use any other products than the ones that you give them in their post-care kit. Because if there is a perfume, if there's perfumes or ingredients like silicones or oils which are not capable of after that treatment, they could really expect even a reaction. So they have to use the package you give them, and inside this package they find an alpha hydroxy acid. And mostly it's after 4 days when the skin starts flaking, they have to apply that alpha hydroxy acid. and leave it on for about 15 minutes, rinse it off, dry it, and best is also to use after this acid treatment our diamond stick to take off all the dead skin cells that the body will push out intensively. And the beautiful thing is, right after using that, the next morning you look in the mirror and it's like, whoa! It's like a complete new skin. It's like a new person standing in front of the mirror. But our clients have to know that. So make them expect a redness, make them expect the intense thirst of the skin, and make them expect also certain flaky areas. But the good thing is you give them the solution right after the treatment, because that should be included in the treatment, and they will have their post-care products automatically, so nothing can go wrong. Actually, every person can be treated, so we don't have to be keen about pacemakers or implants or whatever. It should be a healthy skin condition. If the client is using certain medicine, for example, vitamin A medication for acne, or cortisone, systemic cortisone, or if they are using, for example, medications that influence the healing of the skin, then it's better to wait until that medication has finished. Then there is, of course, also certain contraindications, which inside our trainings and in the training books, they are written very, very precisely. So we can put it this way. Every healthy skin can be treated, no matter what age, no matter what skin condition. So even acne can be treated with that. People that suffer from comedons, they can be erased much more easily after that treatment. Basically, of course, people have to be, they have to be 18 years old. That's all we have to also be sure about. So, if all our pigmentists can work with that technique, I would say basically they have a big advantage when it comes to the hygienic regulations. The GoldenEye MNT, the microneedling technology, is a technique that opens, if and when we're working in the invasive manner, we're opening very small and precise points to the dermal layer. That means it can lead to bleeding. That means a little lymph could flow. And that means also we have to work in a very, very hygienic manner. So let's say it's not a sterile, but the absence of possibility to kind of have a cross contamination. We have to avoid that. We have to make sure what product we put into the skin and what could come out of the skin. So I think a tattoo artist and a micropigmentation artist knows very well about all these points. Whereas we also have to make sure now this is a beauty treatment, so inside a beauty treatment should also be an environment of beauty. I wouldn't recommend to do that in all kinds of tattoo studios. I would try to also, if I'm performing this technique, to go instead of the let's say more rocky and more black colors. I would have at least then one room to be white, to be a bit more beautician-like. And then of course a micropigmentation artist would also understand skin abnormalities. They know what type of skin they can perform a tattoo or micropigmentation. So there is absolutely a pre-education that is very, very positive, and that comes in very handy for them to learn then only most probably in one treatment how to benefit from this MNT. This question is always the first. Does it hurt? I would say it's not that you can't feel it. So if a client would ask me, I would say I would tell my clients, don't expect pain, but don't expect that you feel nothing. It's somewhere in between. And we know that. Every beautician, every tattoo artist, and every micropigmentation artist knows that there is clients that are very and there's clients they fall asleep while having a tattoo on their wrist. So there is different, but we cannot differentiate this. Both of it, both techniques work with needles. Both techniques, especially the invasive technique, will cause a certain discomfort. And we can reduce the discomfort. I mean, tattoo artists, micropigmentation artists also probably are in most places of the world, they know about anesthetics. If I have a very sensitive client, I can recommend to my client to go to a pharmacy and to get, for example, procaine or something like that, that we could, that she would put beforehand on her own face, on her own wrist. Actually, it's not needed. I mean, it's for a good reason. It's for your own beauty, and it's just a few seconds of maybe suffering on one certain point. So I think it's also a question. I mean, you girls have a much more bigger wave between times of being more sensitive and not sensitive. The guys, they are always sensitive. They will always feel pain. You will see. You will see that you work to the point, and this is the good thing in the Golden Eye method. Our hand pieces can be adjusted to every need. So I can actually influence also the penetration depth. I can also influence by using different speeds the discomfort of my client. And I would never threaten her to make sure that she will talk bad about my techniques. So I will always try to keep her on a way that she knows, okay, I feel there's something going on, but she could still recommend to friends and to family members to come to me and to have the treatment done. To apply makeup right after the treatment is not to be recommended, and it's not recommendable because the skin, especially again when we are using techniques that are more invasive, the impact points of the needle, they would remain open and receptible for ingredients for quite some time, and the skin is thirsty after that time. And people would rather think, instead of putting on a makeup, to put on a drop of hyaluronic acid. And this is what I always recommend also, after the treatment, the day after, even 2 days after the treatment, to have just like one drop of the hyaluronic acid, make the other palm of the hand wet, and to apply that with wet hands is super comfortable for the client. Now, if you're wearing makeup underneath that, it's going to be smudgy and it doesn't feel clean. So it is better for the client not to put on makeup, at least for the next 24 hours, even better for 2 days. Now, if I have a client and she couldn't change her appointments and she couldn't change her schedule, and she has to put on makeup the next day, it will not harm anymore after 24 hours because the skin is closed again. And then if it makes her feel better, but then at least she should use a moisturizing mask before the makeup and right when she took it off. Is it bleeding? Well, we differentiate in our approach. We have a invasive approach, a minimally invasive approach, and an invasive approach to the skin. That has not necessarily to do with the length of the needle, as there is also a differentiation of the thickness and of the size of each layer. Therefore, I would say if we're working non-invasive, minimally invasive, bleeding is absolutely not possible, because in that area there is no vascular system. The moment we reach to the dermal layers, the moment we have decided to approach with our technique for the maximum reparation and regeneration, the repair mechanism is pushed much more when we work dermally. That is the moment when you could see very small, very little points, and it's not this typical dark red blood, so it's kind of a mix of lymph and maybe a little bit of blood. I would even say less than a micropigmentation, less than a tattoo, much less. But on certain points you could see like a reddish stripe or a little liquid exiting the skin, but not like bleeding. And please do not expect scabs after. It's really easy peasy, and if we can see as the practitioner to do that, as the beautician, when we take off the mask and there is a little point of blood, we can remove that immediately with a special disinfectant, and then it's gone and it will not come again. So it's not that our client would leave the salon with a bleeding or with a bloody face. Oh yes, all the drugs, as much as we love them. Yes, of course, they do influence. Caffeine influences not only the sensation of pain. For some clients, if they have a cup of coffee, you can immediately see they have like red spots, like nervous redness all over, which other clients will see that when they have a glass of red wine. So in the end, it's to find out how our clientele does react to these sorts of, can I say drugs? Yes. Our clients can smoke right after, whatever. Afterwards, they can have a drink. If they have, for example, a client comes to our salon and she had met a friend before in the city and she had, a glass of champagne, that's fine. No, if she comes to my salon being completely drunk, that is a point when I cannot treat her, because then, of course, the blood is far too liquidish. In the end, we have to find out what is there anything that would make our client, this one client we're talking to now, is there any product that would make her more sensitive? It could also be medication. It could be tons of coffee. I'm not the person who wants to forbid everything just because one client reacts on that. It makes more sense to be more individual, to speak to the client and to find out what makes her more sensitive, when she feels more discomfort. And of course, the best is if she comes just without caffeine, alcohol, or anything else. Scars can be treated, and not only can be treated, but should be treated. Our MNT is fabulous on scars. Because what happened when, I don't know, it could be a cut scar or a burn scar, everything is based on the same problem before. A scar is a kind of replacement tissue. Usually we are working with dermal layers, epidermal layers, and once these cannot be healed because the tissue doesn't find each other, so then in between is a kind of Yeah, it's let's say a replacement. Now, this replacement is not nourished in the same way. This replacement tissue has a complete different way of reconstruction. So it makes a lot of sense, and it is proven by histological tests and cuts that after already the fourth time of impact with a needle inside a scar, that the microcapillary system comes back. So we vascularize the tissue, the scar tissue. That again would help the stem cells to rebuild the vascular system, that would rebuild the cytoplasts, the fibroblasts. So slowly but surely, the scar can disappear or even at least look much better than before. But therefore, we have to have a real intense impact, and it has to bleed. Otherwise, it would not help. How does it feel after the treatment? Well, also here, one says so, one says so. I saw customers getting up, and they were like, "Oh, that was okay." Most clients would get up and like, "I expected it to be really worse than this, but it was not so bad that I thought." In the end, again, it comes to, and every tattoo artist, every micropigmentation artist knows that. We have clients, they react very easily to pain. They are more sensitive with redness, and during the treatment, we and Golden Eye, and with all the tests we did before, and in all the trainings we have done, and all the clients that work with this system already, there was not one that had to interrupt the treatment because the client couldn't manage the comfort or discomfort in the feeling. So in the end, it's nothing that we should call pain. It's a discomfort. I wouldn't want to do it every day, but I want to do it every month because it's incredible what it does to the skin.